Southern California Orthopedic Institute presents A Patient's Guide to Arthroscopic Surgery.
Hi, I'm Joe Burns, orthopedic surgeon at the Southern California Orthopedic Institute. I'd like to take a few minutes to introduce myself and introduce this video. I'm a board-certified, fellowship-trained orthopedic surgeon who specializes in comprehensive shoulder surgery, joint arthroscopy, and sports medicine. At the Southern California Orthopedic Institute, or skoy, we have several doctors, all specializing in different areas of musculoskeletal disease treatment and management. Over the past 20 to 30 years, we at skoy have treated thousands of patients. What you may not know is that we've also trained over 100 orthopedic sports medicine specialists, doctors themselves that spend a year with us to learn and share our knowledge. Research and education has always been important to us here at skoy. What we've learned from our patients in the past will hopefully transfer into better care for you and our patients in the future. We're going to take some time on this video to help explain what we've learned and hopefully help the whole process of going through surgery with the expectations and the post-operative recovery and the physical therapy and everything involved to hopefully make that a little bit clearer for you.
On the day of surgery, you'll be asked to show up usually around an hour prior to the time of your surgery itself. We do our best to keep our surgeries on time, but you can't always predict exactly when one surgery will end and when another will begin. As a result, please bring a book and a little bit of patience, and we'll get you going as soon as possible. The first thing you'll do, after parking on the day of surgery, we'll ask you to come into the preoperative waiting area. There you'll check in and meet our receptionist. After check-in, we'll bring you back to the preoperative holding area where you'll get changed and you'll meet your pre-op nurse. Once you're changed and ready to go, you'll meet your anesthesiologist who will review the plan for anesthesia and go over any other medical issues that may pertain to your surgery. We will then mark the surgical site with the surgeon's initials as well as the word yes, because you can't ever make a mistake with the side of surgery. Once we're ready to perform the surgery, you'll be walked back to the operating suite. So let's go take a quick look at one of our operating rooms. Inside the operating room here, there'll be 5 people. The surgeon, the surgeon's assistant, an anesthesiologist, a circulating nurse, and a scrub technician. All of the materials that we need to complete the procedure are found here in the room. The room's going to be a little bit chilly. That helps keep the bacteria count down and the infection rate down. We will give you blankets to keep you comfortable. When the surgery is completed, we'll move you from the operating table onto a gurney and then into the recovery area. The recovery area is actually going to be the same area as the pre-op area. There, we'll get you perked up and comfortable. We'll make sure your pain's controlled. And eventually, we'll get you changed and into a wheelchair where afterwards you can go home. Now, you will need a ride home from the surgery. You can't take a cab, you can't drive yourself. You have to be 18 years or older to bring you home. Afterwards, expect a follow-up call from either my office and or the surgery center itself to check on you the day after surgery. Any problems, please give us a call and let us know. You'll be given verbal as well as written instructions that will outline the do's and don'ts and things to watch out for after surgery. We encourage you to bring any durable medical items such as slings or braces or crutches that may have been given out prior to surgery. If you need crutch training, please let us know prior to surgery so we can arrange that for you either in the office or prior to your surgical time at the surgery center. We also encourage you to fill your pain medication and any other prescriptions that you might have been given prior to the surgery so you have them ready to go at the time of discharge from the surgery center. The field of orthopedics extends well beyond surgery itself. Both our Valencia and Van Nuys offices are fully equipped with the latest MRI machines to help us diagnose the problems accurately. We also have fully equipped physical therapy and occupational therapy centers that can help you avoid surgery if at all possible, but when surgery is necessary, they help you get back in the game as quickly as possible. The first question that most people want to know when it comes time to plan an operation is, where is it going to be done?
We do surgery at 4 places: the Valencia Surgery Center, Henry Mayo Hospital, COSY, which is a Center for Orthopedic Surgery incorporated in Van Nuys, and Valley Presbyterian Hospital. We've selected these facilities because they provide specialized care that meet our practice. So now we're going to take a little bit of time to go over some of the most frequently asked questions that revolve around surgery. The most frequently asked question that we get is, do I need to do anything up to and the day before surgery in preparation? The most important thing, no eating or drinking anything after midnight the day before the surgery, regardless of the time of the surgery. Special medications that you may need to take daily will be addressed individually. If you have any changes in your overall health, including flu symptoms or other illnesses, please let us know prior to surgery. If you are or could possibly be pregnant, we certainly need to know that as well. Next, when should I arrive at the hospital or surgery center? In general, if you're going to have an outpatient surgery, we like you there at least an hour prior to surgery. If you're unsure of the time of your surgery, please give us a call and we'll let you know. Hospital procedures or inpatient procedures oftentimes have their own specifications and will require you to show up prior to an hour before surgery. Again, if you're not sure, please call the hospital and they'll go over it with you. What to wear on the day of surgery? Don't wear any makeup, but you may shower or bathe prior to coming to the surgery. Loose fitting clothes that are comfortable are usually best. Baggy shorts, sweatpants, button-down cotton shirts, all are good choices. All cotton underwear is best, but no jewelry. Painted nails or toenails are okay. How long will surgery take? Well, it's quite variable. Different procedures certainly take different amounts of time. You can't always tell what you're going to find once you get into the procedure. That can extend or shorten the time accordingly. Most surgeries last between 45 minutes to 2.5 hours. We'll do our best to get you in and out of the surgery as quickly as possible, but not before we've done everything that needs to be done. What kind of anesthesia will you receive? In general, our procedures are general anesthetic. That means you go to sleep. Now, different people have different medical conditions that may alter that plan, and of course that will be dealt with accordingly. There's local anesthetic, where you just have some numbing medication, and there's other types of anesthesia that involve twilight sleep or regional blocks that just numb the area of the procedure. Each person will be dealt with individually, and we encourage you to discuss the options with your anesthesiologist. How long will you be in the hospital or the surgery center? Again, that depends on the procedure performed and how quickly you bounce back. Outpatient procedures usually enable a patient to go home within about an hour of the finish of the surgery. Inpatient procedures, such as shoulder replacements or other bigger procedures, usually involve between 1 and 3 nights in the hospital. We'll get you home as soon as we can. And what happens after an outpatient surgery is completed? Well, from the recovery room, once you're comfortable, alert, and oriented, we'll get you in touch with your ride home and also give you some written instructions that you take with you. Any questions that arise that aren't on these written instructions, please give our office a call and we'll be happy to cover them. In general, you should also have your post-operative appointment all set up. If you can't find the date of that appointment, give us a call and we'll go over it with you so that you can be on time and we can go over the results of the surgery, the special findings of the surgery, and how that may affect your individual recovery. The first thing that you're going to do when you get home is relax, get settled in. Usually use lots of ice on the operative extremity to help minimize the swelling. Pain medications are important. You want to try to stay ahead of the pain. If you need to take 1 or 2 pills as we directed, that's fine. Try to keep on top of the pain as best you can. Certain medications have side effects. You can have nausea, you can have dizziness. They can affect you in lots of different ways. If you have major side effects, please call the office and we can usually find an alternative medication that might suit you a little bit better. The recovery process starts immediately. It starts with first recovering from the trauma of the surgery itself. Pain medications, swelling management, and rest. As time goes by, we're going to want to get you moving. The goal is to regain your high level of function and get it as close to normal as possible. So after surgery, we're probably going to give you some exercises that we're going to want you to start between the day of surgery to sometimes 48 hours later. And we'll give you those instructions the day of your preoperative appointment. They may involve exercises to move your shoulder. They may involve exercises to move your knee. They may involve exercises to get up and around and be active. But also occasionally, we're going to want to go very slowly and protect the surgical site. Each surgery is different, each person's different, so please call us if you don't have a good understanding of what the expectations for moving the shoulder, the knee, the hip, or the ankle may be after surgery. Next stop, physical therapy. After you've completed your initial post-operative recovery, you're up and around and you're moving, we're going to want to accelerate that process as quick as we can. We can't necessarily speed up the body's normal healing process, but we can optimize it. That's where the therapists come in. They can work on getting your range of motion back, they can work on getting the swelling down, and they can work on regaining your strength so that you make as quick a recovery as possible. It's going to take some time, some effort, and a lot of work and perseverance on your part to get the best out of your body. One of the terms that we use very frequently is take what the body will give you. That involves the shoulder, the knee, and just about any part of the body. You don't want to overdo it, but when motion is there or strength is there, we're going to be there to help you regain it. Early in the post-operative period, the goal of all surgeries is a smooth, easy recovery. But if problems arise, we need to know about it. Here are some of the things that you should know to give us a call for. Increasing pain. We do expect some soreness after surgery. If it's getting worse and worse and worse, please let us know and we can adjust your pain medication or certainly bring you in for an evaluation. Fevers and temperatures. The vast majority of people after surgery have an elevated temperature. It may be 99, it may be 100. This is normal. Temperatures over 101.5 should be reported to the office, as it could be a sign of an early developing infection. Fevers that develop 2 and 3 weeks after surgery can also be signs of a developing infection and need to be evaluated quickly. Redness around the wound that's increasing, drainage from the wound after the first 48 to 72 hours should be brought to our attention as well. Now, what's to be expected? Numbness in the hands, fingers, or toes. That's normal. If it's worsening or it's related to weakness or loss of normal function, we need to know about it. It's very common, however, for there to be some numbness and tingling in the fingers after shoulder surgery or in the toes after knee surgery. This should resolve over the next 24, 48 hours after surgery, and certainly by 72 hours. If it's still there, you should let us know. Nausea and vomiting. Very common after anesthesia. Time usually takes care of it. However, if it's intractable and you can't keep down any food, again, we need to know. Sometimes it's related to the pain medication that you may be taking. Sometimes it's related to a bug that you may pick up, and we need to differentiate one versus the other. Please let us know. Sometimes people need medications to minimize the nausea and vomiting, and we're happy to provide that. Other issues that may arise. It could be almost anything. If you're concerned, please let us know. It may not be something that we are the best people to treat, and if so, we'll help you get to see the correct specialist that may take care of any issue that you're having after surgery. Two of the most common questions that our patients ask are, when can I drive? When can I go back to work? We'll cover that now. Driving. The answer is you can drive when you're safe to drive. That means you have to be able to work the pedals. You can't be taking narcotic pain medications. You have to be able to react quickly and work the wheel effectively if something unexpected happens on the roadway. Most people recover within a week or two from an arthroscopic procedure to the point where they're safe to drive. Other people might take weeks or even months until they're safe to drive. Each person's different. Those are the guidelines that we'd like to set for people. Returning to work. Well, that all depends, doesn't it, on what you do for work. Sedentary work
can usually be resumed within several days or at most a week after most arthroscopic procedures. Larger invasive procedures such as shoulder replacement or fracture management may take much longer and need to be managed on an individualized basis. Laborers, people that use their body or their shoulders or their knees or their hips to do their job, are going to take a lot longer to return to work than someone with a more sedentary job. Generally, when you're up and walking, you can go back to doing sedentary type work, but full manual duty may be 6 months and can be a year after some of our more devastating or complex procedures. And again, we'll help you guide through the post-operative period to help manage your expectations and get you back to work as soon as possible. The shoulder sling. It can be a patient's best friend and worst enemy. Slings, braces, crutches, cold therapy units, motion machines, these are all equipment that play a vital role in your recovery. How long do you need to wear it? Well, it depends on the problem. Some patients need to protect the joint and the extremity against any motion whatsoever. For other people, however, we'll encourage you to get out of your sling, get to moving, get to walking as quickly as possible. Any questions that you have, please refer to us. If crutches, braces, or a sling is recommended, it's there for your protection. The majority of problems that arise after surgery, where a surgery may be undone or ruined, arise when the unexpected happens. I didn't expect that the dog would jump in front of me. I didn't expect when I went to the freezer at midnight and I opened the door that the ice cream would fall. I didn't have my sling on and I quick reached for it and I heard a rip. These are the main reasons why we like people to be protected after surgery, so that they can avoid the unexpected. If you have any questions about how long you need to wear your sling, whether or not you can get out of it, whether or not we recommend that you put a little bit of weight on your leg or all your weight on your leg, please call us. But hopefully these questions should be answered to your satisfaction prior to surgery, with the understanding that based on how you do after surgery, we will adjust them and get you back to moving without any assistive devices whatsoever as soon as possible.
So while surgery is often necessary to help the body heal, it's usually not sufficient. In fact, there are several factors that are involved in getting a maximum benefit out of a surgical procedure. Most people are different. There's a huge range of possibilities that can take place after surgery, most of which have nothing to do with the surgeon and everything to do with the patient. While we certainly need to do our part, you need to do your part as well. And in doing so, that can help us get consistently above average, better results than other people would get. So what are some of the things that you can do above and beyond what I do and even what you do in the physical therapy? 1, find time to laugh. It sounds kind of funny, but it's true. A laugh here and there improves your endorphins, improves your body's immune system, and can really help you along the way. It can also get your mind off of what can seem like an otherwise agonizingly long recovery process. 2, early on, get plenty of rest. The body needs it, it needs to heal. Once you start recovering from the surgery, however, it's almost the reverse. We want to start a little gentle, easy exercise because the body responds to that as well. But you certainly don't want to overdo it. Eat well. Surgery isn't an excuse to let your body go to pot. You've got to give your body what it needs to heal. Proteins involve the amino acids that the body needs to repair damaged tissue. It's very important to maintain a healthy diet. Similarly, you want to stay hydrated. Don't let yourself get dehydrated. After surgery, the body sucks up a lot of extra water into the soft tissues. You'll feel swollen. That water is necessary to help the body heal, but you also need to replenish it by staying hydrated. Plan ahead. Surgery is a big hit to your life and your body. Keep the freezer stocked. Plan ahead for meals. Get your family and friends around you to help you. You may want to think ahead and pay bills in advance. These are all things that represent life going on with or without you, and you got to keep up. So what about life going on? Well, I want you to keep up. You're going to fall behind a little bit, but try to keep it to a minimum. Get out. Get back to work as soon as you can. Keep in touch with your family and friends. Go out to dinner. Get some fresh air. These are all important things that, again, can take your mind off of the surgery itself so you don't run over it and perseverate on it over and over again. It's a big part of your life, but it's not the only thing in your life. So these are some of the things that I think are very important to people as they recover from surgery. There's lots of different ways to go about it, but you need to minimize stress and maximize the reality of the life that's still going on and take advantage of what you can. This is a bump in the road, but we'll get you through it.
Research and education. It's always been a big part of our orthopedic program here at skoy. For years and years, we've been leaders in the field of clinical research. Well, what does research mean? Well, it doesn't mean that we experiment on our patients. What research is a drive to do better. We evaluate our patients. We want to know our outcomes. We want to know how everyone is doing so that we can improve. Publishable research is when we write a paper that we can share with the rest of the world that describes what we've learned from you, our patients. As part of our research program, you may be asked to help us out. That will involve some questions. They may involve questions on how your shoulder or your knee is doing, preoperatively, postoperatively, occasionally MRI scans or follow-up x-rays, or sometimes telephone calls. There are different ways to evaluate our patients so that we can average everyone together and figure out who's doing well and why. We appreciate any support that you may have to offer us. We may from time to time call you out of the blue with random questions about your extremity. We appreciate your help. We also have a research foundation called SCORE. It's the Southern California Orthopedic Research and Education Foundation. It's a nonprofit facility that requires donation dollars to function. That's the lifeblood of our ability to do research. Any donations that you may be willing to or looking forward to give, we would certainly appreciate, and we'll give you our contact information as part of this video. I'd like to introduce you now to the classroom. It stands for the Center for Learning Arthroscopic Skills. It's a unique facility that we have here at skoy, unique probably to the entire world. It's a facility that we've set up to help train doctors, students, technicians, and also help to work on our own skills outside of the operating theater. There's a lot of new techniques that are always coming on the horizon, and we don't like to feel as if we're practicing on our patients or on cadavers when we can have models themselves that can help us learn our skills, polish our technique, and make it perfect. One of the things that we've developed in conjunction with a company in Spain is this simulator. It is a state-of-the-art simulator that uses computer programs to simulate the inside structures of the shoulder, the knee, and the hip. These devices right here simulate the actual devices that we would use in the operating room. This is a shoulder model here, and these holes represent the portals that we might use in the operating room. One of these devices would be similar to the camera, and one would be similar to another instrument that we might use at the time of surgery. Then the simulator screen itself will show us what's going on inside the computer shoulder, where we can use our tools to help manage certain pathology that we simulate within the shoulder. This is an excellent way of working on eye-hand coordination, of learning the steps that are involved in surgery, as well as polishing our own technique and helping other people learn and see how we do things here at skoy. The next aspect of the classroom that I'd like to show you involves our actual models. It's not so much of a technological simulator, but a real model. We have models here for the shoulder, for the knee, and for the hip. I'm going to show you a little bit about how we use these models in order to practice and perfect our surgical techniques. Now, I'll start with a little bit about arthroscopy itself. Arthroscopy begins with this here, which is an arthroscope. It's a 3-chip high-definition camera attached to a scope. The scope itself can then be placed inside the body through the tiniest of poke holes and illuminate different joints within the body. In our practice, we use scopes on shoulders, knees, and hips. Now, this model right here is a shoulder model. The head would be over here, the shoulder is to the side. These represent cannulas that we place to hold our place within the shoulder joint, such that we can place the cannula or the camera down one of the cannulas or any of the other cannulas. So I'm going to give you a little introduction about how this actually works to show us the inside of a joint and enable us to not only do surgery, but practice surgery and teach surgery at the same time. The camera itself can be placed through a tiny little poke hole in the side of the shoulder into the shoulder itself. The rest of the procedure can be done with instruments that we have here in the classroom. These instruments are the actual instruments that we use in the OR. Now, these are retired versions. We don't bring these from a live patient to the classroom and back, but these have been used in actual surgery, and these are the real instruments that we practice with. Now, the instrument itself is then placed through the cannula and into the shoulder itself. Now, we don't watch it from outside the shoulder, we watch it from this screen that you see here inside the shoulder. This is a replica of what is actually a rotator cuff, which is the tendon and muscle unit that so many of us damage from time to time, but it's essential for helping us have a pain-free use of our shoulder. When this cuff, which is a sheet of tendon right here, gets pulled away from the bone below it, what we do when we repair it is we stitch it back to the bone with these instruments. So when we would need to penetrate the cuff to sew it back down to the bone, we can practice by using this instrument here to help penetrate and sew the tissue back down to the bone. Now, the steps that we do here in the classroom are identical to the steps that we use in the operating room. It's better to practice on a model than it is in the operating room. Get the steps perfect, get the technique perfect, get the idea perfect, and then anything else that happens to come up at the time of surgery, we manage. The benefits of these models are several-fold. One is you can learn new techniques. Second is that we can practice the techniques that we already know. And third is you can teach the techniques. We educate 5 fellows a year who are fully trained orthopedic surgeons. The classroom is a staple of their education. We need to know that they can do all of the steps of the surgery as well as we can do it before we give them their graduation certificates and send them out into the world as skoy trained specialists. The way they practice is not on our patients, but it's here in the classroom on these models. They need to get the technique perfect. Other people that come to learn are our technicians in the operating room. They're not involved directly in the repair of say a torn rotator cuff, but they're directly involved in the surgery, and we need them to understand the technique in order to help us help our patients. So our technicians come down here, we come down here, our students come down here, and we also have quite a few visitors that have come from all over the world to spend time and learn with us and share with us, and they all enjoy visiting the classroom where we can discuss technique and practice technique together on a model versus a living patient. So here in the classroom, I generally function as a teacher nowadays. But years ago, I started my learning as an orthopedic specialist here as well. So I can tell you without hesitation that this type of situation where we can practice, we can talk, and we can share is invaluable in the development of a shoulder, knee, or hip arthroscopy surgeon. This is a foundation that's a 501c3 tax-deductible foundation that does require support to continue to thrive. If supporting something like this is interesting to you, please give us a call or contact us through our website. So through continuing medical education, practice, a little bit of ingenuity, and a lot of hard work, we promise to keep giving you the best care that's available anywhere in the world here at skoy. So thank you. We're partners in this and we'll get through it all together. But I can't state enough how much we appreciate all of our patients' help over the years to help us learn from them so that we can continue to provide the world's best care to all of our patients now and in the future. So I sincerely hope that you found this video helpful. We'll always do our best to get you as healthy as possible, as quickly as possible, in the kindest, most pleasant way that we know how. Please don't hesitate to call us in the future if you, a friend, or a family member should ever be in need of our services. We're here for you and we'll take as good care of you as is humanly possible. That's our promise.